Hello everyone, my name is Vinod Rawat and I am the co-founder of Vision Sense. Welcome sir. Basically it's a health insight podcast and we have a very special guest with us, Dr. Digvijay, who is a renowned ophthalmologist who has specialized in pediatric ophthalmology, strabismus, amblyopia or lazy eye, glaucoma and neuro-ophthalmology basically, who have almost 17 years of experience in this field and also contributed extensively in his field, from academic publication to state-of-art medical advancement. So, sir, it's a pleasure to have you on the show.
Thank you, Vinod. The pleasure is all mine. And I hope this podcast, gives our audience some insights into the fields we'll discuss today.
Thank you, sir. So, sir, let's start with your journey. You started 12-year training from All India Institute of Medical Science AIIMS. Then you have consultant in Medanta MedCity. You have an experience over there, 3.5 years of experience. And before going to your own venture, that is Noble Eye Care, what basically inspired you to leave that?
So, right from the beginning, I was interested in medicine. When I was, during completing my class 11, 12, I decided to take up medical field. And then I got into AIIMS New Delhi, which was the topmost institute by God's grace. And I spent about 12 years there. And during that period, I realized that, there is a lot that is happening in the field of medicine overall. And then further, I got more interested into ophthalmology, which is basically a field where there is surgery, there is medical aspect, a lot of research and academics. And all of that inspired me to continue to do academics and research even afterwards. Okay. And around the time when I was, I'd finished my training and I was still doing some research projects there. There was an opportunity to set up the department at Medanta, the Medicity in Gurugram, where I came in and helped set them up that department, and I learned a lot from that, of how practice outside is. And we continue to do academics and research. Even today, I continue to teach students. I continue to have, I'm a guide for many students in research. So all of that is also very important or very close to my heart, along with clinical practice, which of course, I do on a regular basis.
Correct. So that's a great insight we got from you. All your journey started from AIIMS and to become an entrepreneur, Noble Eye Care. So the next question is, sir, how did you started your practice, and basically in what specialty you currently you are working right now, and how you treat these patients right now? Yeah.
So, when I was at Medanta, I was working there, then I realized that, if I want to do a very subspecialty practice or a super specialty practice in a way, I need to have my own center, because a lot of equipment is required. Currently, I have trained, to become a pediatric ophthalmologist. So I look after children, I look after squint. So different problems that children have, like squint, amblyopia, which is lazy eye, refractive errors, myopia, powers are coming up in children these days. I also have super specialized in glaucoma. So I look after, adults who have got glaucoma, children who've got glaucoma. That's a disease which is an irreversibly blinding disease. Among the largest, a very, very high in terms of the amount of blindness that it causes worldwide. And neuro-ophthalmology, which is a very special, super specialized branch of ophthalmology, where we deal with diseases related to the brain, optic nerve, nerves of the eye, and squints that the eye generates. So all these, are the super specialties that I've trained into. That is why the training period was so long, at AIIMS. And for all this, I realized, to have our own specialty center, because every doctor dreams to have their own practice, own center. And just when I was doing that, I also got the opportunity to head the eye departments for 2 or 3 corporate hospitals, like Narayana Super Speciality Hospital, Rainbow Children's Hospital, and I'm also visiting a few more. So we look after, multi-speciality patients in those specialty hospitals. And the clinic that I have generated, called Noble Eye Care, our eye center, is now also very well catered to adults and children both. And within children, we look after these specialties like squint and amblyopia.
Great insight, sir. Great insight. So now let's dive directly into amblyopia, sir. So basically, if a patient want to know, if patient, or you can say child parent want to know what is amblyopia in a layman language, and why the early detection is so critical for a patient.
So amblyopia, in common terms is what we call as lazy eye. It is a situation where the vision in the eye has not developed because of either, some high spectacle power or some squint or some other problem in the early years of life. And in fact, you'll be surprised to know that 1 to 4 children in every 100 children are known to have amblyopia, and a lot of times parents don't even know that it is there.
Oh, really?
And the thing with amblyopia, Vinodji, is that if it is treated in the early years of life, only then a very good successful outcome comes. It gets more and more difficult as the child is growing up or going into an adulthood. Even though now there are treatment options that we are giving for adult amblyopia also.
Correct.
But traditionally and before, we look at children's amblyopia. So in fact, I urge parents to get their child checked up. There is now a recommendation that definitely before the child enters school, before the age of 4 years, they should have an eye screening by a doctor, because the child will never know, because in most cases amblyopia is in one eye.
Correct.
So the child has no idea that one eye is seeing or the other eye is seeing, and with both eyes open they never get to know. So by the time it is detected, it gets late.
Correct.
So it is something that parents need to be aware about.
Correct.
And then as eye doctors, we need to learn to treat it at an early stage, and that is what we do.
Correct. So even that's make a lot of sense, Dr. Digvijay. So how can a parent come to know about the sign and symptoms? What should be the sign and symptoms of amblyopia, so that parents come to know that this is a patient or this is a case of amblyopia, and they immediately went to the doctor?
Yes, that's a very valid question.
Yeah.
Amblyopia may not present with any signs and symptoms. To the parent at home, the parent may not realize it is there at all, but there are some things that can be a giveaway. So of course, we recommend all parents, all of you, to do a regular eye checkup for your child before the age of 4 years at least once, get it screened. And there are screening tools that we use to screen amblyopia. But children who are either showing some form of squinting in the eye, closing one eye repeatedly, rubbing of one eye again and again,
Correct.
sometimes developing lot of styes over the eye, eyes becoming red and watery, or having excessive sometimes exposure to screen, or are having difficulty you see in sport activities or activities where depth perception is required, may be having amblyopia in one of the eyes.
Okay, that's a great insight, sir. If a child diagnosed with an amblyopia, so what are the treatment options available in the market right now?
So I think the child has to be checked by the eye doctor, and the eye doctor says that there is an amblyopia or a lazy eye in the child. So the first thing that we do is to give glasses, because we have to correct the cause for the amblyopia. If it is glasses, we have to correct that. If it is squint, we have to correct that. And after that, we have to stimulate the lazy eye to work. Anything lazy needs to be forced to work.
Correct.
So we do that either by patching the dominant eye or the non-lazy eye. And now we also have a lot of softwares that are now come up in the market, which allow stimulation of both the eyes simultaneously and together, as well as stimulation of the lazy eye alone, to speeden up the recovery. So we have eye patching, we have certain medicines, and now these softwares which are actually shown to be very, very effective.
That's great insight, sir, and that's reassuring the patient also that they are getting the right treatment for their child. So now moving towards the vision, development program, which you already shared, that we have software program right now. Can you please little elaborate or give brief that who all are the company behind that, and right now who all are the people who actually doing this stuff to the patient? Yeah.
Yes. So I think the idea initially of amblyopia treatment used to be that we would patch the dominant eye and we would only use the lazy eye to see. But that was causing one problem, that binocularity was being lost, the ability of both eyes to work together. Correct. And that is actually a very big thing. And for that binocularity to be there, these softwares have come in, which stimulate both the eyes either simultaneously or separately, and sometimes both, separately and simultaneously, along with patching and without patching. There are various players in the market. Some of them have got FDA approvals also. There is, Revital Vision, which I've been using, fairly frequently now, which is again it's a company that has come up with a very effective software and has got a proper FDA approval. A lot of research has been done and published. There are certain other players also that are there in the market, you've got Binox, you've got Neurapi, you've got CureSee, which are again based on the dioptic principle. And these softwares also help to strengthen the eye muscles and eye strength and improve squints also in some cases.
Okay, so that's really fascinating, doctor. So And in a child amblyopia, you already share lots of insight about the child amblyopia. What about the adult amblyopia, sir?
So as we were discussing that, amblyopia is best treated as a child, but a lot of the children will not even know that they're amblyopic till they're adults, or they will not get patching done as a child. They are resistant to the idea. Parents are not able to enforce it, and they end up with amblyopia, which continues to get into adulthood. Now in adulthood, the brain is a little more resistant to learning, to changing. Just like it's difficult to learn a new language as an adult.
Correct.
Same way, the brain is more difficult to teach the eye to see as an adult. But there are softwares, and I think one of which is the Revital Vision software.
Correct.
Which can stimulate even at that age, and I think they have got again an FDA approval for older age group also.
Correct.
And apart from that, of course, the same processes of patching and stimulation together work, and yes, it takes a lot more effort, but it is doable.
Correct. So that's really promising to hear, sir. Do you want to give any message to the parents of child that how they should take care of their kids' eye in today's world? Second thing, pollution is very much high. Kids are very prone towards screen, mobile and laptop. So what should be the parents' message so that they can keep their kids' eye good manner?
Yes, I think a very important and very pertinent question for all the parents and guardians to know about. We are seeing that there is a epidemic of myopia. The requirement for glasses has gone up, and it is going up like really steep curve.
Correct.
And we have seen that now in classrooms, if you remember as a child, maybe 1 or 2 children used to have glasses. Now half the class has glasses. In fact, there are classrooms where 80% of the children are wearing glasses. So this has really gone up, and this is happening a lot because of changes in our environment and lifestyle. So as a parent, I think these are a few tips that I'd like to share.